Good afternoon, everybody, and welcome to this joint NNPCF and Contact webinar. Before we proceed and do introductions and the like, just a little bit of housekeeping. So, as ever with these online events, well, I think we're all quite familiar with them now. As ever with these online events, please do bear with us if there are any technical glitches. And hopefully we'll be able to take you through this webinar as smoothly as possible. So we will have the chat function on. It is quite a busy agenda today, so there's quite a lot we need to get through. So I'm not promising at this point in time that we'll be able to answer all of your questions during the webinar. What we will try and do is that if we're unable to get to them, or if we run out of time, we will try and come back to you with any key points that we haven't managed to cover. So without any further ado, I think we'll get going. Today's topic is integrated care boards and what this means for SEND and parent care reforms. So some introductions for you. My name is Mrunal Sisodia. I'm one of the co-chairs of the NNPCF, and also I've been involved in the integrated care boards from a number of angles as well, in the sense that I'm also a non-executive director of an NHS trust, which has been involved in setting up our regional care board. So I bring a couple of angles onto that. And we're very lucky today to have been joined by Amanda Elliot. So Amanda, I'll hand over to you to introduce yourself.
Hi, yeah, my name is Amanda Elliot. I'm the strategic health lead at Contact, which a good part of my job exists to support forums and regional forums to engage and get involved with health, because it's always been historically a tougher area. I've also been representing Contact at HPIG, which was a collective of children's organisations that were trying to get influence the Health and Care Act to make sure it had sufficient focus on children. I probably know some of you out there. Hi.
We're also co-presenting with colleagues from NHS England, and I'd like to invite in Diana to say hello to you all.
Hi, I'm Diana. I'm Diana Boyd. I recently started as family care advisor in the national NHS SEND team. So I advise from a parent care perspective on programs of work within the SEND team. I was until recently a chair of Brighton Hove Parent Care Council, so I very much have that parent care forum perspective on things I do, and I work closely with Mrunal and Amanda and NNPCF and Contact to make sure that's getting through to the national level. So yeah, very nice to see you all. I'm sure there's people there that I know.
Thank you, Diana. You're very welcome, and I suspect that you'll become a very familiar face to PCFs over the course of the next few months. We are also due to be joined by Lorraine Mulroney, who many of you will know who is the specialist advisor for SEND for NHS England. Lorraine is having some tech issues, so those gremlins that I spoke about earlier have hit. So hopefully Lorraine will be able to join us at some point. I think she's gamely battling with her tech at the minute, trying to get in. So look out for Lorraine, and hopefully she'll be with us. Anyway, we'll get going. So this is kind of what we're going to cover today. So a little bit of a recap around some documents and definitions, because this is the NHS and they love their acronyms, and we will be trying, we're trying very hard to let you know what the acronyms are and what all the technical terms mean. Then we're going to have a little section on what do ICBs and ICPs, again, acronyms are coming in straight there, mean for children and young people. We'll tell you what an ICB and an ICP is in a moment. There's also there's some co-production guidance for systems, and we'll take you through what the NHS is saying around co-production at the moment. Then Diana's going to take you through a national overview of what the ICBs, where they are. And then I'm going to lead a little session at the end, which is interactive. So we're going to ask you to complete a Menti poll during this session. as for what this means for parent carer forums. So that's an overview of what we're doing. So the first session, documents and definitions. I'll kick off with this. So there's a number of key documents that we will be referencing into during this presentation. Now, we're not going to go into massive detail around them here, but pretty much everything we say is rooted in one of these 4 or 5 documents. So that's the NHS long-term plan document. There's three documents there around the integrated care systems, integrated care boards, and care partnerships, and what they mean. And then lastly, there's the actual legislation itself, which passed in July of this year, the Health and Care Act of 2022. So I won't say anything more about that, but I just wanted to give you those documents and links to them. Slides will be sent out, so you will have these links. They're live links, you'll be able to look at them. And if you are interested in getting more detail and background on what we're covering today, then that's the place to go. Okay, some definitions. Okay, very quickly, I will go through these, and I'm not going to go through all the text here. Again, you'll get the slides, so you're able to look at these in more detail should you need to. So clinical commissioning groups. These were the groups that had legal responsibility for commissioning prior to July of this year. Over the last few years, integrated care systems have been set up. These are new partnership organizations that are designed to meet the commissioning requirements and serve the population needs across a larger geographical area than clinical commissioning groups. And there's almost a bit of learning that came from the 2010 Health and Care Act, that actually in some ways these clinical commissioning groups were actually too small to function effectively, hence the creation of integrated care systems. Now, integrated care systems are now made up of really 2 key boards, or 2 key bodies. The first is the Integrated Care Board. This is the body that has taken over the legal commissioning duties and the functions that were previously held by the clinical commissioning groups. The guidance around these is starting to lay out what they need to be doing and how they need to engage, and that's going to be the core of what we talk about in this webinar. Next to the integrated care boards sits something called integrated care partnerships, ICPs. So these are essentially a statutory committee that bring together the NHS and local authorities and other groups as equal partners. The idea being that integrated care partnerships set the direction, set the strategy for an integrated care system, which then the integrated care board, as the legal NHS body, is responsible for delivering. But more on all of this later. Some of the terms we might use. System. So the system is a term that's used to mean the integrated care system. So this is basically the area, the geography that is covered by an integrated care board. Typically, they have a population of about 1 to 2 million, and often these system areas cover multiple local authorities. They have a many-to-one and a one-to-many mapping to local authorities, which is really, really complicated and unhelpful, but it is what it is. Then you get to this idea of place. So within a system, there are defined places. Now, these are usually local authority boundaries, but it could be other local relevant definitions. So, for example, district councils or towns. Typically, a place will have a population of somewhere between 200,000 and 500,000. And places are typically at local authority level served by health and wellbeing boards. A neighbourhood is a subsection of place, and the idea is it brings in population sizes up to 50,000. And primary care networks and neighbourhoods are made up of local GPs, pharmacists, opticians, dentists, local on-the-ground services. The next phrase that we might refer to is this idea of provider collaboratives. There is now a requirement for all NHS and foundation trusts to be a part of provider collaboratives to essentially work together rather than competitively to deliver services to a system. So the idea is that the people who are commissioned to deliver services have a duty now to work collaboratively. And this, if you think about this, this could be collaboratives across geographies. So that could be a number of NHS trusts coming together to deliver community services across a number of systems in a more joined up way to give them scale, or it could be vertical. So for example, tier 1, 2, 3 NHS mental health providers working together within a system to deliver more joined up services as children move up and down the tiers for CANS. Last two definitions for you. Apologies, this is the dry bit, but we need to get it out of the way and do it properly because we'll be referring to all of this stuff throughout the rest of the presentation. ICP strategy. ICPs have a specific responsibility to develop a strategy for its whole population, and ICPs are actively doing that now. They are working to develop strategies, and more about how you can get involved in these development of these strategies later. And then the ICBs have a requirement to produce a 5-year forward delivery plan of how they will implement these strategies. They also have to take notice of the national NHS priorities and which include the NHS long-term plan. So that's the definitions bit, that's the drier bit. So here's a slide, which again, you can look at in detail. This outlines the 42 integrated care boards across the country. And at the bottom there, you'll see how they break out into the 7 NHS regions. There are a different number of ICBs in each one of the regions. So again, hopefully you're familiar with this. You can find more details by following the links. A lot of what I've just said is detailed in this CDC infographic. The link is there. Please take a look. It describes again the role of the ICBs, the ICPs, systems, places and neighbourhoods, provider collaboratives, role of health and wellbeing boards, and place and primary care networks. So a lot of what I've just talked through is summarised if you follow this link and on this slide. So again, it is confusing. Do not be afraid of being confused. If you need to refresh your memory or want more detail, this is a really good resource to look at from our colleagues in the Council of Disabled Children. And then the other thing that we'd link you to is a video from the King's Fund, which gives an overview of how the NHS works and how it's changing. The link is there. The King's Fund are a national health think tank who've done a lot of explaining around how the NHS works, and I for one have often used their resources just when I'm scratching my head and saying what on earth is going on here. So please do use that resource as well from the King's Fund. Okay, that's enough for me for the time being. I'm going to hand over now to Amanda for this next section, and Amanda, please let me know when you want to move the slides on.
Okay, yeah, great. Well, I'm going to be talking to you a little bit about what the new boards and partnerships mean for children and young people. And we're looking at mainly what the legal duties and the guidance says about this. So great if you could move me on to the next slide, please, Mrunal. So the key legislation behind this is the Health and Care Act 2022 that came into force in July. And the key thing is it transferred all the relevant duties from the old CCGs to the new ICBs. So there was pretty much a straight map across on the things that relate to disabled children, children with SEND. What's really good is that children are one of only 2 groups that are explicitly mentioned in the Act. The others, I think, are pregnant women. So the government was very specific that they didn't want to be too prescriptive for the new boards. They wanted to give them freedom to meet the needs of their local population. So we did actually lobby quite hard to get children and young people into, along with about 70 other organisations, including the national network, through something called HBIG. It took a lot of lobbying, but we're grateful that that's now in. In terms of accountability, because we know always that matters to our families, they have to set out their accountability structure. That's the ICBs, the boards, the beating heart, the legal body, about how they're going to meet those statutory duties, including for children. So there is a structure of accountability of sorts. It's very high level. I mean, that will become clear as we move through this. And the other thing is the integrated care strategies that are being prepared at the moment, the first ones, prepared by the integrated care partnerships, must explicitly consider children's health and well-being outcomes. So that's worth remembering. And among the many duties transferred, the ones most relevant to our families are SEND, mental health, child safeguarding, looked after children and children in the justice system. There are more, but those are the key ones that matter to us. Could we move slides, please? Mrunal. So you're very familiar with the key legislation around this. It's the duties under the Children and Families Act 2014 and the related code of practice. They're pretty much the same duties, except they're moved from an organisation, the CCGs, that were fairly close to the population, 200, 300,000 people, to a much bigger footprint. So that presents challenges potentially, and maybe something to think about. Apparently the code of practice is being updated to reflect the change. I haven't seen that yet, but I presume they've got that in hand. And responsibility for SEND accountable functions should be delegated to an integrated care board executive lead. That's someone on the board who will lead on SEND. It's quite likely to be the chief nurse. All these boards have a requirement to have a correct skill mix to perform the functions and meet the duties. So it's like, it might not always be the chief nurse, but more on that later, I think. It's difficult to assess where different areas are, but I've been involved with a piece, starting to get involved with a piece of work in Southwest London ICP, who have thankfully appointed the DCO for Kingston on Thames, who's a really enthusiastic champion of parent care forums and co-production. And she is being appointed as ICP Head of Special Educational Needs and Disabilities. So she'll be involved with a subcommittee that will be helping the board and the executive lead meet their SEND duties. So, you know, what they're potentially looking at is a subcommittee of a subcommittee looking at children, and then that feeds into the board. So people are starting to put the plumbing together, the structure, and it'd be really interesting to know what's happening in other areas around those things. So it is an evolving structure. If you could move again. So obviously all of this throws up massive challenges, but also potentially some opportunities. So one of the biggest challenges is, how do we all ensure that the visibility of SEND in these new systems, particularly where the integrated care boards, the ICBs, have so many competing priorities, and to be frank, will have a massive focus on older people and reducing hospital care. So, you know, it's about being seen, being heard in that, what I tend to call is the wedding cake structure, you know, a lot of tears, quite high level, and being heard high enough level. One of the questions that are unclear is how SEND partnership boards will operate at place level. Are they going to have more or less influence in the new system? I know they're quite key, involved in improvement plans after the SEND area inspections and that kind of thing. So, you know, it'd be interesting to see what happens to the power and influence. And I know some of you sit on those boards, so, you know, obviously they matter to you. Maybe those discussions have already happened. I'd be interested to know, actually. Obviously, the obvious plus is the clues in the name, integrated care boards. And, you know, we all know how much our children need integrated, joined up services across healthcare, education. And so one would hope that it will deliver more joined up care for our children, young people and their families, with more collaboration built into the system. So that, you know, that's more of a, let's hope it delivers on that. Potentially they can. And obviously that's part of that is the scope for commissioning and delivering more consistent specialised services likely to be across a bigger footprint, partly from because there's a shortage of staff and they need to be able to think bigger to scale, but specifically around autism and learning disabilities, you're likely to see some change. That can hopefully will mean a more consistent standardized offer across for more children. The other question is, will there be adequate capacity sort of structure to support key SEND roles such as DCOs and DMOs? I know they've become very important people for forums as being the link to health and ensuring the HCP process is as seamless as possible. And, you know, in this new system, what will that structure look like now? Will there be enough to cover the bigger footprint? Next slide, please, Mrunal. So there's stuff coming up that you probably need to be aware of on your radar. So one thing that's due is the NHS England statutory guidance to the executive leads in integrated care boards across the following portfolios. So there's some guidance, probably quite high level, saying to these to the leads on the boards, guidance on children, on SEND, on learning disability, on mental health, Down syndrome because of the recent act, and you know the ever-present safeguarding as well. So we're really looking forward to seeing that guidance, because it will be something that guides the boards around our children and families. Also, more recently, an independent review of the integrated care system's been announced. It's been called the Hewitt Review. It's looking at red tape in the system fundamentally. And, you know, we all hate red tape and we're quite glad for it. They make a bonfire of it. What we don't want is that in the process that accountability for children also for disabled children goes on the bonfire too. So yeah, definitely one to watch, and probably an opportunity to raise issues that directly affect children with SEND. There are some strategies. The first wodge of strategies are due out of the integrated care partnerships in all your areas at the end of December, and children must be explicitly mentioned in those. So be interesting to see if they also mention SEND or how often. You know, you can do a word search on these documents and that should tell us. And they should also be mentioned in the forward plan that the integrated care boards produce. And then there's something called Core 20, which I'm less familiar with, but I had a quick look at today, which is a new inequalities framework, so tackling inequalities, and there's potential there for children and young people in different areas of that, whether from Black and minority ethnic backgrounds, or they have particular health conditions, or they're autistic or learning disabled, but they feature in this framework. So definitely have a look. It's fairly easy to follow. So yeah, some of the it's core 20 plus 5. Children with SEND are really in the plus, and also children with mental health needs are in the +5, along with other health conditions like epilepsy. So worth looking at all those sections, because these are all levers when they're preparing strategies and forward plans that they need to really make sure they're keeping an eye on. Next slide, please.
Amanda, can I just jump in there perhaps and just say a little bit about the core 20 plus 5, because yes, so this is very new. The idea is that they're taking the most deprived 20% of the population and looking at of children and looking at the health inequalities that group faces. And then they've added 5 categories where they have identified, the NHS data shows that the health inequalities for these 5 areas in these 5 groups are disproportionate. So asthma, diabetes, epilepsy, oral health and mental health. And it's really interesting the kind of work they're doing around this, in the sense of, you know, oral health. The reason they choose oral health is some new research out that I was told about last week, that one of the best indicators for long-term health outcomes is whether a child has tooth decay at the age of 5. If a child has tooth decay at the age of 5, the likelihood is that child will have as it grows up, will have pretty poor health outcomes. So the idea being, we can use things such as oral health as a proxy for identifying those children who are going to have the worst health outcomes going forward. And of course, again, for children with SEND, oral health is something that again is often a challenge. So it's actually using the data that the NHS has in a smarter way to try and identify areas of focus that might actually move the dial most effectively for the most disproportionately affected groups in the country.
Just to add, that was really helpful actually, because I don't know so much about this, but what I do know is that it's very, very likely in April 2023 that responsibility for commissioning dental health services, including community dental health services, so the special ones that often our children need to use, are being handed down to the Integrated Care Board. So, you know, it's something to keep an eye on, because we know many of our children struggle to get the dental service and care and treatment that they need. So yeah, great. Could you move to the next slide, please? So here are some examples of strategies that are due at the end of December. So there's a draft consultation. The consultation date's now finished, but so this can probably help you understand what they need to cover and what they're likely to look at. I don't know if any of you have actually had a chance to contribute to any of these. I suspect some have and some haven't, but I think this is being very much viewed as a sort of first strategy. These will be reviewed and refreshed each year, so that you should, if you haven't been involved at this point or prior to this point, then it may be worth trying to get in when they find out when they're reviewing it, and make sure that you're involved at those points, because they're pretty key, these strategies, because they set the priorities basically. So those are probably worth a quick look. Next slide, please, Mrunal. So that's the legal side. The next, well, there's more legal to come, but co-production, this is something that matters to us as forums and as parents of disabled children, whether it's individual co-production or you know, strategic. So let's have a look what's going on in that respect. So great, if you could get the next slide up, please, Mrunal. Okay, the key document, the statutory guidance for that you probably need to have a quick spin through, is working in partnership with people and communities. So this is very broad. It sets out the public involvement, legal duties, and the arrangements to, they must make arrangements to secure people are involved. And that can be in a variety of ways. So that's the latitude bit. That's the freedom that each of these ICBs and ICSs have to involve people. So there's some overarching law, and then there's some that people can do what they want in local areas within that structure. They need to make sure that resources are available to do this effectively. So that's likely to be in engagement strategy, and so communications and engagement teams in ICB. So it might be, if you're going to make one phone call, it might be worth contacting those people just to say, hi, we're here, and making them aware, particularly if there's new personnel in those types of positions. They may not be aware of you. So the boards and hospital trusts must demonstrate that if they're making a decision about services, they have to show that they've assessed whether the duty to involve applies, and then if they decide it does, they need to properly follow that process and show how they've done it. So it might not be that you're involved in everything, but that's something they're obliged to do. There's also policies for boards and partnerships and place-based partnerships and provider collaboratives to involve people when developing plans and strategies. So less strong, but still something that's expected. The integrated care partnerships, not the boards, should consult children's systems leaders. So that might be, you know, the cabinet lead for children's services in a particular area, or the heads of education or SEND or whatever, when forming those strategies. And also the performance of these ICBs will include how well they deliver their statutory duties, including how they involve people. So there is some scrutiny of this, though not the granular scrutiny that we would like, that, you know, we'd like them to say, and have you involved parent care forums, you know, obviously. And for trusts, providers, community trusts, hospitals or whatever, they have a contractual responsibility to involve people. So it's part of their contract to do so. So they're in breach of their contract if they don't. Great. If you could move to the next slide, please, Mrunal. So these are just some at a glance sort of structures to show you what the duties are, which laws and stipulate these, if you ever need to quote them in a letter or a correspondence. As you see at the bottom, for integrated care system partners, it's good practice. Involvement is considered good practice. It's not a legal requirement, but there are other layers where they're required to do so. Next slide, please. So this is another graphic that I've nicked from, I can't remember who, NHS Confederation or someone like that. Yeah, this shows you what, how, where and how, what they involve people for. So for the boards, it's about the planning of services and any decisions and proposals that impact on services if they're removing or changing a service. And yeah, the integrated care partnership has to show how they've involved leaders and representatives of local people in planning those strategies. Place-based partnership, obviously, for single forums may be quite focused on some of this, either through your partnership boards or through your relationship with the health and wellbeing boards. And then the provider collaboratives, as I mentioned before. Next slide, please, Mrunal. So what the statutory guidance says on involvement. Sorry, we've done this one, haven't we? We've got a duplication. So I suppose the question is, what are the opportunities for strategic influence, particularly in relation to the integrated care partnerships? These are sit next to the boards, but are actually a committee of the boards, and they're charged with assessing the health and social needs of the whole area and producing the strategy that's due at the end of December. And that strategy will influence what the integrated care board puts in its forward plan and what it commissions, if you like. So the integrated care partnership is, as it sounds, is a partnership for people from the local area. It includes someone from the integrated care board, local government representatives, that might be councillors or executives, voluntary sector, very broad, could be voluntary sector providers or voluntary sector support groups or whatever, and health and care providers. So that again is broad. That could be voluntary sector, or it might be health and care agencies, you know, care agencies that work in the borough, so providers of care. Housing, another definite on those partnerships is Health Watch, but they also have freedom to decide who else is on that board. So that's just worth something bearing in mind. So parent care forums with good links with Health Watch, you may have done some work with, may want to use this as one route to influence those integrated care strategies. I know they're variable, so it really depends on your local relationships. I was at Barking the other day and the Health Watch came down to talk to the forum, but it was the first time, but at least that conversation's starting. The other way of looking at this is more strategically, that if you've got a group of PCFs, parent care forums in an integrated care board area, and you've got pretty good links and you meet regularly, you may wish to collaborate and decide and approach the ICB about representation on the partnership. So on the partnership committee, because you know you will be representing a lot of people across the families, disabled children and their parents across that area, and you know, legitimately I think you'd be entitled to. Whether you got one is another matter, but that's worth thinking about. Also at the very end here is a link to an annex in the guidance on preparing integrated strategies. The only reason I've included that is there's a whole list of people that the integrated care partnership may want to consult when preparing strategies. There's a bit of a spoiler alert, it doesn't mention parent care forums explicitly. It talks about carers and disabled children and that kind of thing. So, but it is only it's not meant to be exhaustive list. So again, it's one of those situations where the parent care forums are going to have to go and say, we're here and we're representative and we, you know, we're key players, and we've done a lot of this before. So next slide, please. That's it for me. Thank you.
Great. Can I maybe just pause a moment there, because there were a couple of questions for you, Amanda, in the chat.
Okay, sorry, missed those.
No, it's fine. I wouldn't expect you to be covering those. So a question from Wendy just around the age, the definition of children, young people for integrated care boards. Is it 18 or 25?
It's what we've always known, which is 18 for most children and 25 for SEND. So that still applies. That's the children and family definition. But obviously, when it comes to social care, things get very different at 18. So yeah, it's what we're aware of. But yeah, those are the definitions.
And also, sadly, will also vary service by service as well. And we know that some services go up to 16, some to 18. And so I'm afraid there isn't a simple answer, but the definitions remain the same for ICBs as they did for CCGs. But we know that practice is very variable. Another question from Matthew from Ealing. It just wanted confirmation that it's the 31st of December for all ICP strategies.
I don't know about that. If that's the date we've put in, then it is. I think that they will be reviewed, and I don't know how tolerant NHS England's being about those that are late. Some maybe Lorraine and Diana, you could pick that up in your section. But my understanding is that for the first draft of the strategies, it is the 31st of December. But please correct me if I'm wrong.
Mrunal, can you hear me?
I can, Lorraine. Welcome. Over to you, and I'm happy to I'm happy to navigate the slides for you.
Okay, so just picking up on that last question, my understanding it's the 31st of December, but of course that's a month away. There's a lot of other things coming our way in the next while, but if there is a change to that, Mrunal, we'll obviously let you know, and Amanda. Are we okay to start? And apologies, because I'm in my car and it's been a nightmare getting through the NHS firewalls. So we wanted to spend some time, I know Diana's introduced herself, but wanted to talk about some of the stuff that's coming out of our heat map exercise for SEND. And this heat map, we're about to go on to stage 5, but the purpose of the heat map is, obviously, with transition from CCG to ICB, we want to ensure that all the statutory duties, they're all transferred over. But how are ICBs dealing with this transfer, and how are we supporting them nationally and regionally? So the heat map has been an exercise of self-assessment, but we've had oversight at region and national level. So we finished stage 4 at the end of September, which had 17 key lines of inquiry, and those were around leadership, data and intelligence, co-production, partnerships, wider sort of leadership and partnerships, not just within the ICB, but within the provider collaboratives, etc. So I want to focus on 2 of the questions around co-production and partnerships that we put into the heat map. And just to show you what it says across the 42 ICBs, and of course I'll not be naming the ICBs here, I'm giving you a sort of general overview. And I guess the purpose of today, you could put it in the chat or get some information back to us via Mrunal and Amanda. We want to really hear what's your experience of co-production and working with the ICBs, and what's your experience of the partnerships and how things are there. Because in stage 5, which is at the end of January, we want to drill down a little bit more and triangulate some of this data. So you'll see that I've put the 2 questions. So the first one was around, can the ICB, with its integrated care partnership partners, describe the arrangements in place for effective co-production? So they had to send in documents, any information, any projects that they have been working on, any examples of working effectively in co-production. And 32 of the ICBs, which is 76%, said they could and provided evidence for that. 8 said that they only could do that partially, they're on a journey. And 5%, only 2 of the 42 said no, they couldn't provide any evidence. So I guess it's really that's their view, but we want to hear what the parent and carer's view is, and also children, young people as well. And then the second question was around the partnerships and being able to demonstrate effective partnerships in place. Now, we know through, working in this field for a while and through the SEND inspections, partnerships and leadership with those partnerships can be a challenge. 31 of the 42 ICBs said, yes, they actually felt they had effective partnerships in place at a place-based level, but strengthening at an ICB level. 7 said partial and 4 said no. So, of course, for us in SEND, the new footprints is very much place-based, so local authority footprints. But the biggest, I think you heard earlier, there are 2 ICBs in the country that cover 10 plus local authorities. So, that is a lot of people to connect. And really, all of these arrangements you have to bear in mind as well is that we're in a transition for ICBs. They have a year of transition since the 1st of July. So our job really is to support our ICBs together with our regions to ensure that they become on their heat map, not a red. We only have 1 red in the country, but definitely an amber and moving into a green across all these key lines of inquiry. So at the moment we have 3 greens. We have 1 red and the rest are amber. So that's all I was going to say, Mrunal. I don't know if there's any questions or thoughts from people.
Just one question so far, Lorraine, is essentially around the transparency of those heat maps. So it's from Danny. Will the heat maps be shared with the local areas? So can parent care reforms see how their ICB has assessed themselves?
So I've asked the regions, because these are held and owned by the regions. So I've asked the regions to work with their regional colleagues, and that should include your regional PCF representatives. So you can have that conversation and decide between you how you want to share things, how you want to triangulate the data, and maybe that would be useful as part of step 5.
And just to share, we the NNPCF, we have already been in contact with Lorraine's regional team to ask that very question. Essentially, we're hoping that the heat maps can be shared at regional meetings, and I think it'll be a really good discussion point. Okay, great. Thank you, Lorraine. You've managed to join us from your car, I think. So well done. Diana, is there anything you wanted to say at this juncture to about your role in all of this and how you fit in?
Yeah, sure, Mrunal. So in terms of looking deeper at stage 5, so I'm going to be feeding into what that might look like if we're looking at co-production, what would be useful questions to be asking. I'm very interested to know what parent carer forums are saying about co-production with ICBs. So I'd really be very interested in getting feedback on that. So yeah, if there's any comments that people want to put, given the chat, because this obviously is self-assessment from the ICBs that feed up, ultimately out trust, but it'd be interesting to know what people's experiences are on the ground.
So Dan, I'm really happy to have a conversation with you after this webinar about how we facilitate that, and I think that what I'm envisaging in my mind is working together in an invite from the parent care reforms for an NHS lead to come and join each regional meeting to share those heat maps and have that discussion. I think that would be a really healthy thing to do. Okay, let's see if we can set that up. Okay, great. So let's see if I can move us on. So what does this mean for parent care forums? So I'm just going to take you through this last bit. And as ever, we do try hard to gather some information from you and co-produce this stuff with you as we go. So please go to menti.com. Hopefully, many of you will be familiar with this, if not all of you familiar with this. We've used this on a number of times on webinars recently, and it works really well. So please go to menti.com, enter code 31186270. And hopefully the presentation will come up. So I'm going to try and switch screens now, so bear with me. And you should, if you go to menti.com, start to see these questions. So I think there's 5 or 6 questions that we've asked you. You can scroll through them at your own pace, so we do not have to wait for me to move forward or backwards. But please just, they are hopefully pretty simple yes/no questions where you can answer them very quickly. And I'll give you all a few minutes just to go through, and we can gather some live information now. And we'll take a few minutes at the end of the webinar just to unpack some of the results, what we're learning. In the meantime, I see there's a couple of more another question comments come in from Jenny, just commenting that they work very closely with the Children's Commissioner, who sits on their ICB, and that's their main point of contact. Yes. So question from Claudia, LDA is the Learning Disability and Autism and/or Autism workstream in NHS England. So I see the scores are cranking up there. I'll just give it a few more minutes, and we'll start to take a look at the results. We've had 30, so we've got roughly 50 attendees on this session. So I'll wait till the numbers clock up till about 40 responses. Then that means we've hopefully got about 80% of the people responding to the questions. And yes, of course, and Margaret, completely understand if you cannot, if you don't feel in a position to respond, that's absolutely fine. Great. Okay, so let's take a look at these results. So one of we've asked these questions to gain a bit of an insight into how you're working, how the ICB is working, and how we are working as parent carer forums across the ICB. So one of the things we said earlier was that ICBs are and ICSs will cross many local authority areas. Now, of course, local parent carer forums are set up in local authority areas. And one of the key things that we will probably have to do to respond to this is to make sure we are working with our colleagues, our other parent carer forums who share an ICB with us. Now, I know that some areas have got quite developed working relationships. They've actually put in place memorandums of understanding of how they're going to work together to face off against and co-produce with the ICS. Other areas have delegated responsibility to one lead forum. Other areas, I know, rotate between the forums as to who goes to which meetings to share the workload. There's no right answer to this, but the key thing is that about half of you are working with your other forums in your local areas that are covered by the same ICS. About half of you aren't. I'd really, really urge those of you that aren't working together with your other PCFs that you need to start doing this and need to start reaching out to them about doing this quite urgently, because as we said earlier, the strategies are being developed now, and the more that we can engage with a coherent voice as parent carers, the greater chance we've got of getting what we need in those strategies. Okay, moving on to the next slide. Have you been involved in the creation of the children's strategy? So really interesting actually here, and Lorraine, quite different results to what the ICBs have fed back themselves. So only 2 saying that it was co-produced, yes. 4 respondents saying it was consultation. 7 saying they were informed, and the majority saying that they've had no engagement at all. So we are probably not surprised by that, because there hasn't been a lot of these changes have not been made, there hasn't been a lot of publicity around these changes. The communication hasn't really filtered down and through yet to communities about what ICBs are and ICSs and the fact that ICPs are developing strategies at the moment. So again, hopefully this webinar has given you some of the tools you need to go and knock on some of the right doors and ask the right questions to get involved in this, because we probably don't want to wait to be invited. We probably want to invite ourselves. So is SEND a priority in the strategy for your ICB? So really interesting. Majority of people don't know, and that probably reflects the last slide where there's actually not been a great deal of involvement. But interestingly, of those people that do know, SEND is a priority. And I'm pleased by that. And again, not surprised, because I know that SEND has been a priority nationally and has been pushed onto pushed by the NHS very effectively as a priority for the long-term plan. So that is pleasing that the majority of people who know are saying that it is a priority and it does feature in the strategy. We probably need to find out more from those 23 that don't know at this point in time. Okay, do you know who is the children and young persons lead for your ICB? So earlier in the presentation, Amanda mentioned that there is a requirement for there to be a executive lead for children and young people in each ICB. If you do not know who this person is, go and ask the question. Just go and ask. You're contacting the ICB, ask your DCO, DMO, whoever it is you've worked with previously. In the CCG or it should even be on their websites. Please go and look and find out who the children young persons lead is for your ICB, and make contact with them. That's going to be a key contact for you, a key escalation point for you as parent carer forum. So please go and find that out. I'm pleased that some people do know who that person is. There's also a requirement, as Amanda said earlier, for there to be an appointed SEND executive lead for each ICB. Find out who that person is and build contacts with them. Again, use all the channels I described earlier. Talk to your previous DCO, DMO. Talk to your leads in the local authority. Go to the website. There's a requirement for there to be a named person. It may well be the same person who is the children and young persons lead. There's no stipulation that they have to be separate people. It's kind of, as Amanda said earlier, it's possible and quite likely that it may well be the chief nurse. Do you know there's also a requirement for there to be a learning disability and autism lead in your ICB? Again, most people don't know who that is. Go find out. Okay, that finishes off the Menti slides. Really, really interesting feedback there. Essentially, what I take from that is that co-production is probably not where we want it to be, and that there's a good deal of work that parent care forums can do, hopefully equipped from this webinar, to go and ask questions and knock on the right doors now to get the right level of engagement. So some takeaways for you. These are questions to go in and make sure you are satisfied as parent care reforms. You are satisfied with the answers to, and these are actions for you. So go and look at your SEND joint strategic needs assessment. So this is each place, each local area has to have a joint strategic needs assessment that outlines and project what the needs of the local area will be. SEND should be mentioned in your local JSNA. Some areas will have a specific JSNA for SEND. Go and find out what your JSNA says about SEND, because that will be a cornerstone of what drives the strategy in that area. So find out, make sure your JSNA is up to scratch. Go and find out where children fit into your ICS strategies, the ICS's strategy when it comes and the 5-year plan. Go and ask that question. Is SEND a priority for your ICS, and does it appear in the 5-year plan? Go and ask that question. Find out. Make contact with the executive lead for children SEND and SEND in your ICB. If you don't know who that is, find out. Ask the question and reach out to them and make that contact. Make sure you've built up contacts with the other PCFs in your area, because the more you can speak with one voice, the more effective that will be. The more joined up we can be, the more compelling our arguments are. And finally, do you know how SEND will be represented on your integrated care partnership? Have you got the links with the charitable organizations, with the health watch groups, with the providers who are sitting on that integrated care partnership, to make sure that your points can get across to them? So as ever, we always try to leave you with a few takeaways. So there's some things to hopefully you can go and do now that you've been equipped and briefed through this presentation. So I will stop sharing my screen there, because we are at the end. I see we have very little time left, two minutes left. Apologies for those who posted questions late in the session. We hadn't had time to address those. Hopefully that has been useful to you, and as ever, we welcome your feedback, and we will look at the comments and we will look at the chat and try and answer any questions that we haven't managed to cover today. I'll leave it there, other than to say, if there's Amanda and Diana and Lorraine, if there's anything else you wanted to finish with on that point.
Nothing from me, just thank you very much for listening. And we know how complicated it is, because Mrunal and I spend far too much time thinking and looking at this, so we understand. Hopefully as it evolves, it will get more interesting and more dynamic. But take care, everyone.
And thanks from me. That's really helpful feedback, and I'll take that back to my regions and build that into our heat map plan, and we'll be in touch about how we work together. Thank you.
Yes, thank you. That's yeah, I think some of the answers reflected what I thought might be the answers. So yeah, very good to have that a bit of data around it. Thanks very much.
Thank you, guys. Bye-bye.